Good afternoon, everybody, and welcome to our LGBTQ vaccine Q&A. I would like to welcome our panelists. In no particular order, we have Dr. Simon Hinks, GP, who is from the NHS Vaccine Programme, Alistair Hill, who's Director of Public Health, and Becky Woodywith from Public Health from Brighton Hove City Council. Becky's the Public Health Principal. Right. My name's Billy Lewis, and my pronouns are he and him. So I'm going to hand over to our panelists, and they will discuss amongst themselves and share information about what they've been doing in and out of the city, Brighton Hove, during this pandemic, and give you more information, and then take the floor for questions. Some questions have already been sent in, I've already been given those, but more will come through as people watch. So I'll hand over first to Becky, please.
Hi, yes, I'm Becky Woodywith. I'm one of the public health team at Brighton Hove City Council. As you all can imagine, we've had a busy year trying to do our best for responding to the COVID pandemic. Recently, my whole focus has been on trying to address some of the issues around the vaccination uptake and support people to feel confident about it, and working with different parts of our communities to do so.
Thank you. Alistair, please.
Thank you, Billy. So I'm Alistair Hill. I head up the public health team, which Becky is a key member of. We've been locally overseeing the response around preventing and managing outbreaks. We don't do this alone. We work really closely with the NHS, universities, schools, community and voluntary sector, and community members. I think it's been an incredible year and a really difficult year for everyone. In Brighton and Hove, we've had more than 400 people, unfortunately, have died from COVID, and we've had 14,000 cases that we know of, and probably many more that weren't diagnosed as well. So our focus now is trying to get us back to some kind of normal. Working with the NHS on the vaccination programme is an absolute priority, and is one of the ways we're going to get out of this.
Thank you, Alistair. And now over to Dr. Simon Hinks, please.
Thanks, Billy. So, yeah, my name's Simon Hinks. I'm a GP in the city working in Port Slade, and since the beginning of January have been clinical lead for the Brighton Racecourse GP Vaccination Hub. So helping set that up, working with a number of practices across Brighton and Hove to deliver that. I think to date we've done about 34,000 vaccinations, and we cover about 3/4 of the city's practices. So it's been a busy time, but it's also been very rewarding work, coming together with pharmacists, nurses, GPs, healthcare assistants, marshals, just to deliver as many vaccines as we can. Thanks.
Thank you. Now, I know that you've all got other things that you would like to share, and that there are presentations. Do you want to go with the presentations before we go with questions? Do that?
Yep, I'll gladly do that. I'll just share it now. Can everyone see that? Is that working? Yep, I'm assuming that's a yes. So we've only got 8 slides, so it's going to be relatively quick, because I think the conversations and the questions are where much of the most interesting discussion will happen. So we're just going to talk a bit about the benefits of the vaccine, who can get it and where, a bit more about the vaccines, what will happen on the day, side effects, some specific questions we know came up that we've seen already, but have also been asked of the LGBT Foundation, and then we'll get on to the kind of the more detailed discussion. And I'm going to play a tag team really with my other co-presenters here. So just moving on. So why do we need the vaccine? Well, you know, as I said, more than 400 people have died in Brighton and Hove, if we look nationally, more than 125,000 people unfortunately have passed away in this pandemic. So a huge impact on people. Many more people have been very ill over the last year as well, and that's obviously had very profound impact on them as well. And then dealing with the pandemic, the kind of lockdowns, the restrictions that we've had to have in place to protect everyone is something we really want to move beyond, and vaccines are at the heart of that. So the vaccine protects you from catching COVID if you have it. It protects you from getting seriously ill, being admitted from hospital and dying from COVID. But the key thing about vaccination is it's not just about you. The great thing is it protects everyone around you as well. And the more people that have it, the better the protection is for the community. So it's about family or loved ones or community members, all the people that we want to be mixing again as soon as possible. So it really is contributing to the community. It's about the NHS and care services. We can't go through another year like this again. The impact has been really difficult and the health service has coped just so well. But we know we've got a backlog of people that need seeing for other things within the NHS. And it's about getting back life back to normal. The impact that this has had on our personal lives, on our communities, on the economy, on wider issues such as mental health. The vaccine is at the heart of getting us to the next stage in this journey. As well as that, we want to keep the cases low. You might have been hearing about variants, and they're more likely to develop when there's more COVID around. So this might be happening in other countries, but as we know, we had a variant in Kent, and the more cases there are, the more likely the virus is to mutate. When those variants come, they could either act differently. So the Kent variant was much more transmissible, so it's so much easier to get it. Or there's potentially a risk that it could make the vaccines less effective as well in the long term. We don't have any of those variants prominent within the UK at the moment, but we want to keep these numbers down. We don't yet know how much the vaccines can stop the disease being passed on. So we're just waiting for more research, but we do think it has an effect on that. So the benefits are massive to yourself, to everyone you want to mix with, but also to the people you've never met as well. Simon and Becky, do you want to add anything to that?
I was just going to say that you mentioned before about the European picture and how many people had been affected by COVID in Europe. Can you remember what that figure was? It was shocking.
Well, more than 500,000 people have died in the EU, significantly more. So the numbers are really, really significant. It's a terrible event that we've all been through.
Yeah, and I mean, I think you make a good point, Alistair. It's not just about us, as individuals, and certainly, if you're a bit younger, you may think, what's all the fuss? But I think, we can't, as a society, carry on in lockdown off and on indefinitely. And I think all of us could really do with getting back to normal for mental health reasons, financial, and many other things.
Okay, thank you. I'll just move along. This is kind of quite a factual one. So who can be vaccinated? So there's a national schedule that the Joint Committee for Vaccination and Immunisation worked out the best way of rolling out the vaccine, and it prioritised those who are most likely to get very sick and most likely to die of COVID, and then the people that are closest to them, and particularly the most vulnerable. So those living and working in care homes, health and social care workers, people who've been shielding because they have particular conditions that make them vulnerable to COVID, people who have other medical conditions, and recently learning disability has been added to that list as well. Age 16 to 64, so quite a wide age range there. unpaid carers who are looking after those people who are very vulnerable. And then it's been gradually moving down the age range, and it's just reached everyone aged 50 or over. So that's kind of where the program is so far. And anyone on that list is eligible to get a vaccine now. The next phase will be moving to people under the age of 50. So it'll move 40 to 49, then 30 to 39, and then finally 18 to 29. And it's still to be decided how it might be rolled out to children and young people aged younger than that. The aim is in England for every adult aged 18 and above to be offered a first dose by the end of July. Anything to add, team? Nope.
Don't think so.
So how and where can I get a vaccine? Well, it's changed a few times along the way, and many of us might have received letter invites, and we can respond to those. Some will have been contacted by practices. But at the moment, eligible people can book online or they can book on 119. People who are 16 to 64, who've got one of those underlying health conditions, should have been contacted with a letter or by their practice, and they can arrange a vaccination at one of our GP-led services directly. Simon, you probably know quite a lot about these options. Do you just want to describe them a bit?
Yes, so with the 16 to 64, that bit had been left very much to the GP-led vaccination services. So there are 3 across the city, and they cover all GP practices. And if you're in that group, you're correct in saying that the practice or at the racecourse, we have a sort of centralized booking hub for all the practices. And you will have been contacted if by text normally, but if you only have a landline, then someone would call you and book you in. The mass vaccination centre at Brighton Centre is very dependent on whether you get a letter which is sent nationally, and then you can book in after that. We have the Community Trust, Sussex Community Foundation Trust, have been going out and vaccinating eligible housebound patients. And also we've recently started a sort of roving outreach, which is sort of going to various places where we highlight there may be people who would want to be vaccinated rather than turning up to one of the other vaccination centres. And I think we can sort of come back to that in some of the questions later.
Thank you. Thanks, Simon. And just to say where we are at the moment, the vaccine supply nationally changes quite a lot. So sometimes there's an enormous amount and other times it slows down. April's going to be a bit of a slowdown period, and there's fewer vaccines available nationally. And the other thing that's happening, and we had a question on this, is that there are more people coming through who need their second dose. So they're 12 weeks on from when they had their first dose. So there's going to be a concentration on those within April. So anyone who qualifies now but hasn't had a first dose has been asked by the NHS to arrange an appointment by the 29th of March. So, and then there will be fewer appointments, but then they will start to open up in a few weeks' time. And at a certain point, it will open up to those people under 50 as well. I don't think we can say exactly the date when that will happen, but it's a bit of a change, the pace in April. So I'll move on. 2 vaccines available in the UK, the Pfizer-BioNTech and the Oxford AstraZeneca. They work slightly differently, different methods, but both are around targeting proteins on the virus to help the body respond if it comes into contact with coronavirus. Neither of the vaccines has the virus in it, so you cannot catch coronavirus from the vaccine. Both have been approved by the MRHA, which have very strict standards on safety and effectiveness. And in the UK, they're being used 12 weeks apart, and they're 2 doses. So it's really difficult to compare and say which is more effective because the studies are slightly differently, but basically they're both very effective. And where one might be better at what it might be better in the short term, the other might be better in the longer term, but they are both very effective against disease. And certainly if you look at by age, 80% of hospital admissions prevented in over 80s, but effective at all ages. It's important to, Simon, do you want to come in?
Yeah, no, it was just around, it was just to say, I mean, I think we've had a lot of inquiries about, oh, you know, can I have the Pfizer, can I have the AstraZeneca? And obviously as different news stories come out and what have you, it kind of changes week to week. But actually now, really what's available from now on is just AstraZeneca. We do expect some Moderna to come in, but we don't know when that will be. All the Pfizer is being held back for second doses because that was the bulk of people that have been vaccinated up until now. So anyone being vaccinated, you know, over the next couple of months is quite likely to receive AstraZeneca.
Thank you, that's really helpful. And for both of them, it's important to note that you need the second dose to get the full effect and the long lasting protection as well. Just down at the bottom of the slide, the licensing for them. So adults is, so AstraZeneca is for 18 plus, 16 plus for Pfizer. So that has been used actually for clinically vulnerable 16 and 17-year-olds. They're not yet licensed for children, but there are a lot of studies underway at the moment. They're fine for breastfeeding, and there's the guidance at the moment is not for while you're pregnant, but that is very possible to be reviewed over time. Speak to your doctor. There's lots of research underway on it at the moment, and some has been reported this week, and it's positive. So on the day, I went this week and it was incredibly easy. You just basically follow the instructions as you get them. You go, you bring your mask, you have your booking number on your phone or on paper, and you just follow the instructions you get. You're going to be asked some questions about history of allergies. You're going to register. You'll receive the vaccine. If it's Pfizer, you'll have to wait a bit. You'll book your second dose. You'll have your leaflet with information about the vaccine and any side effects. And then the important thing to note is when you go away, you can't drop all the regulations and the social distancing. It's absolutely vital that we all continue to do that. So Simon, you've worked much more than I have in this setting. Anything you would add to the day?
Yeah, I think you talked about the 15-minute wait after the Pfizer-BioNTech, but if you're driving, you also have to wait 15 minutes after the AstraZeneca dose. You know, in all the centres, they're brilliant volunteer marshals who will make you feel welcome and comfortable. You know, we're using experienced vaccinators, so if you have anxiety around having the vaccine, you'll be really well looked after. You know, we do everything we can to sort of make adjustments if you have sort of particular requirements or particular anxieties. You know, so we will try and do everything to sort of accommodate individual needs, but at the same time, you know, we are trying to vaccinate as many people as possible. But you know, certainly if you're going to one of the GP-led vaccination centres, you know, talk to someone. There'll always be a phone number you can call so that, you know, if you have some particular requirements, just having some pre-warning about that can be really helpful.
Thank you. Thanks. Becky, is there anything you wanted to add at this point?
When I went a few weeks ago now, I went to the Brighton Centre. It was very well marshalled as well. Lots of space between people, plenty of room, very airy. I didn't feel hemmed in. I didn't feel worried about being close to other people at all. And there were lots of seats in the queuing area. So if you wanted to sit down all nicely spaced. I thought it was really well managed. I won't look at the Brighton Centre again the same way.
Thanks, Becky.
And I think we were going to say that we've all had our vaccine. So because I was working in the hospital vaccine hub, I had mine very early on. So I had the Pfizer vaccine. I did feel a bit spaced out for an hour or so. Nothing too drastic, and then a bit of a sore arm the following day. So that was my experience.
Thanks, Simon. And Becky?
Yeah, I had a side effect, but it was minor compared to some of the old 1980s travel vaccinations that used to seem to wipe you out for days. It really was very minor, and you know, but nothing compared to how ill I might have become if I'd have got COVID.
Thanks. And I had mine on Monday this week, and I don't actually like needles particularly, but I didn't even know it had gone in. Basically, I hadn't realized it had been done, and I had no side effects from that one, so that was good news for me. We've got a slide on side effects. Simon, do you just want to kind of whiz us through that one?
Yeah, so I mean, what we've been saying is, you know, it's similar in a way to the annual flu vaccine, and you know, the most common side effects are things like sore arm, feeling tired, headache, unwell. You might get a bit of muscle and joint pain, and you may get some chills. So you know, it's almost like getting a bit of mild flu. You know, and they're saying that that can be more than 1 in 10. Of vaccinations. Sometimes you can get swelling or redness around the injection site, and you know, very rarely severe allergic reaction. And I said earlier, we've probably done about 34,000 vaccinations up at the race course, and we haven't had a severe allergic reaction. So it is very rare. You know, we have a full sort of crash team that's allocated every day. So if that should happen, you know, you're in the best possible hands.
Thanks, Simon. And I just put a link at the bottom there because there has been some coverage about the AstraZeneca vaccine and blood clots in the last few weeks, which the evidence has been reviewed in the UK and it's been reviewed in Europe as well. The evidence around general thrombosis is that it's not suggested by it's caused by the vaccine because lots of people have these events. And the thing about these vaccines is tens of millions of people are now having them across Europe. So it's not surprising that some people are ill 2 weeks on, 4 weeks on, because people who haven't had the vaccine are likely to be have those kind of risks as well. So there's a link there to the latest NHS guidance on that, but basically the evidence suggesting that the clots, no evidence suggests they were caused by the vaccine, and the advice is still to get vaccinated when invited. So I think we've got a question or two on that. We can come back.
I just wanted to say one more thing. I think it's worth reminding people that those very common side effects are your own immune system doing its thing, which is very positive. So in a way, when I had my side effect, I was thinking, great, that's really good. My system still works.
Yeah, and I just want to say a couple of things about allergies. I think a lot of people concerned if they have something like a penicillin allergy that they're not eligible for the vaccine, and you know, that's not the case. So you know, when you come and have your vaccine, you know, the person that will vaccinate you or consent you will go through that. But because you've got allergies to medication, that isn't, in most cases, a reason why you can't have the vaccine.
Thank you. Thanks both. I put this slide up because we got quite a few questions in advance about hormone replacement treatment, about HIV medication, about PrEP and PEP. And I noticed these had already come up in when the LGBT Foundation up in Manchester had been doing surveys and webinars, and actually have a page, a really good web page, which I've done a link to, which addresses these questions directly. So basically for all of those medications, there's no scientific reason suggest why the vaccination would interact with them at all. So there's no reason why you wouldn't have the vaccine if you're having any of those medications at all. So I hope that's reassuring. The web page is there. Simon, do you want to add anything on that from your GP perspective?
I mean, just to say, obviously, you know, since we've started vaccinating people in Brighton and Hove, we will have vaccinated people on HRT, ART, PrEP, you know, and as far as we're aware, there've been no problems with that.
Yeah. Okay, thank you.
I mean, the other thing just to add is, you know, you'll be given a leaflet, and if you do get any unusual side effects after the vaccine, then you're encouraged to report it on something called the yellow card scheme, and you can just go online, put in what vaccine you'd had, the dates, and if it's not one of the common side effects that we went through earlier, then you are encouraged to report it, because it helps with the sort of national monitoring and learning.
Thanks. No, that's a really good point. Thank you. Just a couple of quick slides left now. So I think it's really important to note this is just one stage in the journey, and we still, after you've had your vaccination, you still need to keep following the restrictions and guidance that's in place. Well, firstly, we know it takes a few weeks before they start to work. So it could be 3 weeks or so. There's still COVID out there in the population. We've been in lockdown, but the numbers are still higher than they were nationally last summer as well. And not everyone is protected yet. Not everyone has had that vaccination who needs it. We need 2 doses for the full benefit. We don't yet know how well it stops disease being passed on, so we have to be a bit cautious there. So there's still a chance you could get it or spread it, even if you've got the vaccine as well. So this is part of our way out of COVID, but we need to take it very carefully and one step at a time. And I think the country's doing really well on that, but the whole situation is a bit fragile. And if we all start not following the rules or stop social distancing immediately, the risk is that we start to go backwards, and we absolutely don't want that to happen. So this is a great step forward, but we're not quite there yet.
Yeah, and I think it's really important to emphasize, do get your second dose, because I think, again, it goes back to that. Then you can be sure that you're getting the maximum protection, and that then feeds for the sort of population as a whole. And if you haven't had your first vaccination yet, you should now be able to, whether you go to the local GP sites or the mass vaccination sites, you should be able to book your second dose at the same time, second dose appointment.
Yeah, thank you. Thanks, Simon. And when I went on Monday, I booked my second one. And if you book online, you book your second one at that point as well.
Yeah.
Thank you. And I've just ended up with a few links, which I don't know, Billy, whether you'll send this presentation around, but I thought there's some useful links. There's a great video by Dr. Sam Hall, who many might know as a GP at Brighton and Health and Wellbeing Centre, talking about LGBTQ communities and the vaccination. There's some information about the NHS vaccination services and frequently asked questions. The LGBT Foundation page I linked to. The clinical guidance relating to HIV medication is in what's known as the Government Green Book. And then finally, advice about HIV and COVID-19 vaccination from the British HIV Association, BEVA, and that is absolutely consistent with what I said earlier around the LGBT Foundation page, that people should be going to be vaccinated and don't be concerned around the interactions. So that's our slides. I'll just unshare.
Okay, thank you. Has anybody else got anything to add to that before we go on to questions? No? Okay, cool. I'm sure that some of the answers to the questions that we've already been saying have been reflected in the slide, but just out of courtesy, engaging, I'd like to still read them out. I'm going to start with the live ones that are coming in, and I'll just open it up to all of our panelists, so you feel free to just jump in as and when you need to. So Rachel has asked, I'm a member of one of the GP surgeries involved in the racecourse vaccine. It doesn't appear on the NHS website. Is there a way I can get my vaccine there, as it is much closer to where I live and therefore easier for me to get to?
Yep, so I'm happy to answer that. Yeah, I'll just get the telephone number of the booking hub and you can give them a ring. So I'll put it in the chat for you. Just let me find it.
While you're doing that, Sam was asked, have you had many people with side effects waiting after they have been jabbed up at the vaccine places?
So it's hard to answer that because if it's the Pfizer vaccine, we only see them for 15 minutes, and if it's AstraZeneca and they're not driving, they're straight out of the door. I mean, I think obviously sort of seen reports of Europe where staff have refused to have the AstraZeneca because they're concerned about the side effects. I think some you know, some people, if you're working and stuff, have to sort of, so that they don't necessarily end up having to take time off work, sort of schedule it towards the end of the week, so they've got the weekend to recover. But I can't really sort of comment except for, you know, myself, other staff I've known, and stuff. So, you know, it's varied. Some people don't have any reaction. You know, some people have been off work for a day or two because of it. But it's hard to sort of predict as an individual what your reaction will be. I think just to emphasize what Becky said earlier, you know, if you're getting a strong, you know, if you're getting lots of side effects, you're probably having a strong immune response.
I think I read in some of the research, it was saying somewhere between 1 in 10 people to 1 in 14 people might feel unwell afterwards.
Yeah.
Sam's also asked, I've not heard from my GP yet, although I have moved in the last few years. Can I book a vaccine appointment without getting in touch with them?
Without getting in touch with your GP, yes, absolutely. So the booking hub, I mean, depending, in the West Hove hub, it'll be your practice that get in touch with you or just send you a text link to book in. At the racecourse, we have a booking hub that covers all the practices, and we'll either send you a text, or if you don't have a mobile phone, then we send, you know, we'll call you on your landline. If you don't have a telephone, then we'll send you a letter.
The other way I did it, because I hadn't got my letter yet, I went on the main NHS booking site once I heard that you could go if you were 50 plus, and I just put my details in and it allowed me to book, but I could only do the Brighton Centre through that. I live very near the racecourse, so it was that, you know, I was happy to go down to the Brighton Centre. So it's just another way of getting in is the national website as well, and you don't need a letter to do that.
Thank you, folks. This is a question that was sent in over the last couple of days. I'm not registered with a GP here. My GP is in Liverpool. I'm not going back. How can I get my vaccine here? I'm 45.
Okay, so you don't need to be registered with a GP to get a vaccination. You know, I've just put through the booking hub number for the Brighton Racecourse vaccination centre, so do give that a call. And I assume also that you could call the 119 number through the National Booking Service. So absolutely, you don't need to be registered with a GP to have the vaccine.
Just to come in at the end, because it went quiet, and the end of the question is, they're 45. So I guess it depends whether they're clinically vulnerable or they've been shielding, or whether they're a carer, a registered carer. If they're not that, they probably will have to wait a few weeks before they're able to have the vaccine.
So we do unpaid. We do unpaid
Yeah.
carers as well. So they
Yeah.
don't need to be official at all. It's just if they're caring for someone that they either live in the same household or they're visiting them in another house regularly, we will vaccinate as a carer.
Well, if they're unpaid, if it's a relative that's looking after someone, how can someone prove that?
Well, you know, at the race course, we're taking it on trust, and certainly we were vaccinating people that would accompany the person being cared for, if you know they were seeing them regularly or lived in the same household.
Can I just add to that? Also, the Carers Hub, which exists already and has existed for a number of years to support informal carers, unpaid carers. And it is a really good opportunity if people have a caring role that they haven't felt has been recognised to date, to register with that, because there might be other services and support that they can access. I'll find it and stick it in the chat.
Okay, brilliant, thank you.
Simon raised a really good point there, that actually anyone can go with someone else for a vaccination, can't they? If someone's worried about the vaccination and they would like someone to accompany them, you can go with someone else, whether that's your carer or you know, someone else in your household. So I think that's really reassuring for many people.
Yeah.
Thank you. I'm going to go on to the next question. My partner and I have been shielding as he is HIV positive and unwell. He's been offered his vaccine this week. I have not. When can I have the vaccine?
So certainly at the race course, just go with them and say that you live with them. Yeah, because you're in a household with someone that's in one of the vulnerable groups that's being vaccinated, and therefore, you know, in order to protect them, you need to be having the vaccine as well. So, and I think that would be true for all of the GP vaccination sites.
Billy, you're on mute, I think.
Sorry, I'm just so used to it. Talking to myself like a budgie in a cage for 3 months. Okay, so this one has already been asked. It was already on one of the slides, but just because it's here, if there is anything else that needs to be added. So, will the vaccination interact with my hormone replacement therapy or treatment?
There's no sign. We're not aware of any reason that would be the case, and I think, you know, we will have vaccinated already thousands of people on HRT and hormone replacement therapy, and there isn't any data coming out that that's a particular cause for concern.
Okay. Can you tell me more about the blood clots I've been hearing about? Why is the vaccine not being given to under 55s in Europe?
Well, it's a sort of changing picture. So it's the AstraZeneca that initially wasn't being given to it's over 65 in some countries, over 55 in places like Belgium. And I think that was initially because the European medicines regulator didn't feel that there was the data sufficient to recommend that. But we've just had the over 80s study from the US, which shows almost 100% effectiveness at preventing serious disease and hospitalization. So different countries have taken different views of the initial trial data. Sort of going specifically to the clots, you know, this vaccine, I think, Alistair, you said it was 20 million AstraZeneca, was it?
Yeah, so I've got the European Medicines Agency report that came out and said there have been some very rare cases So firstly, 20 million people have received the vaccine, and there's 25 rare types of blood clotting that were found amongst that. And it said it can't be shown that there's a causal link, but it does deserve further analysis. So I'm reading from it there. And so that's, on that basis, that's around 1 in a million. Overall, they're saying the benefits are just so great compared to those extremely rare risks. So we have to put this against more than 500,000 people dying on the continent, and more than 100,000 people in the UK as well. COVID has a very significant impact on communities, from deaths, from the long-term effects of COVID, from hospital admissions. So it's a very serious condition in that sense, if it's prevalent in the community, whereas these are extremely rare cases that aren't proven yet.
Anything else?
And I think it's true to say that COVID illness, severe COVID illness, can have an effect on blood, can actually cause blood clotting also. So
Yeah.
that's part of the decision and picture really for everybody to remember, I think.
Thank you. Another question. I want to start looking after my grandmother again. I'm 23, living in Withby. When can I expect my vaccination?
So, I mean, I think Alistair laid out the ambition nationally is to vaccinate. When was it? Every adult by July?
By the end of July,
End
yes.
of July.
Yeah, I mean, obviously, they're saying they're looking after their grandmother.
Yeah.
So I guess there's a decision as to whether they're a carer there, an unpaid carer in that sense. So there might be an option for them there. I don't know how much they would look after their grandmother and whether they would be an unpaid carer as such, or just visit their grandmother.
Have the people giving the vaccine been trained in dealing with trans community? I've not been out in a long time. I'm worried about attending the big vaccine places.
So, I mean, there's a couple of things there. So, I mean, all people working in the NHS have have to complete statutory and mandatory training, which includes training on equality and diversity. I mean, I'd be really interested to know, from that questioner, whether they had anything particular in mind when they asked that question, and also actually, if there's some really good resources, I'm very happy, certainly from the racecourse point of view, to put that out to everyone that works there. But generally in the NHS, hopefully with that training, and an emphasis on equality and diversity, that individual should have a good experience. I've certainly had a couple of trans friends who've been through the race course, and they were very happy with it. Okay. Sorry, I think there was another bit there as well, wasn't there? Oh yes, about having not been out a bit, and obviously the race course and also the Brighton Centre, they are big centres, and absolutely can appreciate that particularly people have been shielding and everything. It's sort of going into these big things. Again, it goes back to we will try and make reasonable adjustments. And if you're particularly anxious and stuff, then let the booking hub know, and we can see what we can do. We have a quiet area that we can vaccinate people in, which just sort of takes it away from the sort of hubble bubble of a busy vaccination site.
Thank you. Okay, the next question. My girlfriend and I live a very secluded life, but wear masks and protection everywhere we go. No one enters our home, and we have no contact with anyone other than each other. So why would we need to get the vaccine?
Shall I take that one? So, I mean, I guess at some point, you know, I can't speak on behalf of the questioner, but you know, we're missing seeing people and going out, you know, and that's having a real toll on us. I think it's having a real toll on individuals and communities, and you know, I know the LGBT communities are enormously affected by that. And if we're going out, you know, the vaccine has benefits. It's about, even if we're young, it's about, it will stop us getting it. We don't know what the impact will be from COVID. And we know that some people have so-called long COVID. We're still learning what that means, but there are lingering effects in young people that we don't know much about. So everyone is at some level of risk. It's also about protecting the other people, so we don't then pass that on to someone who might perhaps be worse off than us, someone we've never met as well. You're just helping the whole community, so that's a great thing you can do. And I think the more people that are vaccinated, it will help society, it will help us all get back to normal, you know, and the impact that will have on mental health, it will have on the people's jobs. There are a lot of benefits apart from the benefits to yourself. So I would encourage everyone to think really broadly about how you're helping yourself, but you're also helping everyone else in your community, and Brighton and Hove.
Okay. Some of this has been covered. What are the common side effects of AstraZeneca vaccine? Can I ask for a different vaccine?
Okay, so I think as I said, so when we started vaccinating in December, it was mainly with Pfizer, and then the AstraZeneca was brought in. There's a limited amount of Pfizer, and we have to keep some back to do the second doses. So that has pretty much run out now, so that no one having their first vaccination from now will really have a choice to have Pfizer. So it's pretty much going to be AstraZeneca until the Moderna vaccine comes in, which is a mRNA vaccine similar to the Pfizer. So not really. We spoke earlier, you know, there's probably not a substantial difference between the two. You know, while we were giving Pfizer, we did sometimes give people AstraZeneca if they had multiple allergic reactions, but it's unlikely you'll be offered the Pfizer from now on. So you don't really have a choice, but there's probably not difference between the two, significant difference.
Thank you. Next question. I've been getting my hormones off the web, including testosterone. Is this going to change the way I react to the vaccine?
No, again, you know, there's no scientific reason that we're aware of that would be the case.
Many age treatments, fast tracks, were not particularly effective. They had bad side effects, and those hopeful of receiving a cure or treatment were punished twice. The rushed vaccine rollout feels like that. I'm not feeling that enough trials and tests have been done on it.
Okay, I mean, I think, you know, I think everyone sort of sees the authorization by MHRA as being rushed, but in fact, it wasn't rushed at all. It was just put in a sort of sequential way, so that rather than looking at one bit, you know, evaluating it and then getting on to the next bit, it was all done at the same time, and therefore all the necessary steps have been gone through. There have been no shortcuts. It's just that rather than going from, you know, one aspect of authorization, getting that complete before getting the next one done, is that they were done in parallel. And, you know, by doing it that way, we've had a head start on vaccination. You know, we've probably avoided, you know, considerable number of deaths. You know, with any luck, we won't need to go into another significant lockdown. And, you know, this is sort of going to have a lot of benefits. Obviously now, you know, the vaccine has been given to millions of people. All countries, you know, have a monitoring system, and I spoke about the yellow card scheme. So, you know, things are being looked at very, very closely. You know, if any sort of longer term effects coming up, you know, we should be aware of that quite quickly.
I think it's also worth saying about the development of the vaccine. I was reading, I read a bit around this very subject, and I know that they were already looking at coronavirus vaccinations through the SARS work, so which again, I can't remember the date of SARS, but the sudden acute respiratory virus that was around a while back. So they were using that and the MERS to look at developing a coronavirus vaccine. So they had some ideas before we even started. Also, they had been looking at an RNA vaccine as well as an option. So there was some development work in the pipeline there. And remember right back at the beginning, and Alistair and Simon, correct me if I'm wrong here, but I think the Chinese did the, collated the genetic code for the virus at a very, very early stage and shared it immediately. And often in the past, in terms of development of vaccines, sometimes that process hasn't happened. And if you think the pharmaceutical companies had a lot of upfront funding and collaborated, and that is one of the other really important things I think to remember. So yes, they ran the trials and they analyzed the data in a different format, but there was also this sort of support for the system to develop something quickly, and we had something to go on, which I think is sometimes lost, that message. I think it's quite important. It feels reassuring to me, and I hope it does to other people listening.
Thank you. I'm going to take some questions from the floor now, live ones that have come through, so that people don't think we're ignoring them. I have a question. Are you going to have drop-in vaccine sessions at gay venues when everyone is open to have one?
So yeah, kind of saw this coming. So we do have the sort of mobile vaccination unit, and I think Public Health, my organisation, you know, sort of working together. That has already started going out to different communities, and I think that's that sounds like a good idea, and I'm sure that we'll take that forward as a suggestion.
Okay, thank you.
Yeah, if I just come in, but this is something I'm aware, Becky, you're really involved with. It's but that option has really increased in the last week, and I think we had a few written questions on this, so I think we should take that away, discuss it with here, because it seems a very interesting proposal. Yeah, we can look into that and see what's possible.
Yeah, and I know that venues have been offering as well.
Have they? And Billy, that would be really helpful if you'd be able to let me know which venues would be the most appropriate. There is always one little caveat, as if the mobile vaccination unit can actually park there with enough space around it to make sure everybody is suitably physically distanced.
Yeah.
But if you could email me the suggestion of venues, then I'll explore that with the mobile vaccination unit and colleagues and the various community groups.
Okay, thank you. Okay, the next question. I seek asylum here. I'm not allowed to claim from the government funding. Can I also receive the vaccine treatment? I'm a gay male African.
Alistair, I can't see why not. I don't think there are any specific laws against it. If you're living here, then you should be eligible.
I can help on that one, I think.
Great, thanks, Becky.
The NHS has the CCG locally have a really good frequently asked questions page, and that is in there as well. So if you haven't got any papers and you haven't got an NHS number, you can still have the vaccination, you're totally entitled to it. And it's a case of booking either using the local system rather than the national system, as I understand it. But I did put the FAQs in the chat, but I realized I didn't send it to everybody. So maybe Billy, you can do that for me afterwards.
Yeah.
But that has a bit more of an explanation for people in it. But yes, everybody is entitled to the vaccination for free.
Okay. And Becky, just off of your answer there, Sam's asked, what is the CCG? How do we find their website?
Sorry, I didn't hear the last bit, Billy.
What is a CCG and how do we find their website?
Yeah, I will put that again in. The CCG is sort of like, very simplistically put, the local branch of the NHS. It is part of it. Obviously, the hospitals are other parts of it, and the GPs and the pharmacists and everybody else is part of the wider NHS umbrella. But the CCG has a website that's Sussex-wide that has a lot of useful vaccination information, including links to translated and BSL videos and such like as well. So I'll put it in and share it with everybody rather than just the panelists like I did just now.
I just popped something in the chat, which I got, which was about, do I need to be registered? It says people do not require an NHS number or GP registration to receive a vaccination and should never be denied one on that basis.
Okay. Jane has asked, a friend has recently had their Pfizer second jab postponed due to availability. Mine is due in a couple of weeks. Will there be a problem?
So, as I explained before, we started vaccinating with Pfizer because that was the first vaccine available. As we gave people their first doses, this was all logged sort of centrally, and we now receive specific Pfizer vaccine, of which there should be sufficient quantities to give everyone their second dose. And we get little packets coming, every 2 or 3 days to make sure that people get their second Pfizer jab. And there should be enough allocated nationally to complete the second jabs of everyone that's had a first jab. Obviously, sometimes there are delivery problems, and I don't know in this case why it would have been postponed, because I'm reassured that there is sufficient quantities to give the second doses, but obviously you have to kind of set the stuff up and everything, and sometimes it may not be possible to set up a whole clinic in time. If the second dose is slightly outside the 12-week window, that's still absolutely fine. And is not a problem, but the aim is that we will be giving second doses at around 11 to 12 weeks.
Okay, thank you. Does anybody else want to add to that? I'll go on to the next one then. So we had a question that comes in. It sounds crazy, but my partner does not want to have the vaccine. I do. Is there any way I can have it without them finding out? They are ranting about daft theories all of the time.
If it's your medical records, it's confidential, isn't it? You don't need to share that with anyone you live with, and that information shouldn't be shared with them either by the NHS, and wouldn't be.
Okay. Go to the next one. Will the vaccination interact with my HIV medication, such as ART?
Yeah, I mean, at the moment, we're not aware of the vaccine interacting with any medication, and again, we're not aware of a sort of scientific reason why that might be the case. And certainly, there were people in the trials who had ART, and it didn't flag up any problems. And obviously, a lot more people will have been given it now who've been taking ART.
And that British HIV Association webpage might be really helpful as well if people want to read in more detail.
So I'll go on. Is the vaccine available privately? I'd like to get my partner and I vaccinated now. We are happy to pay, both in our late 20s and otherwise
No, it's not available privately.
healthy. Once I've been vaccinated, is it okay for me to hook up with other vaccinated men?
Alistair, do you want to answer that from a public health perspective?
I mean, my first way of answering it would be to say, I mean, firstly, from what I said earlier, you know, one vaccination is not enough to guarantee protection. So if it's about, are you at risk of COVID or are you putting other people at risk of COVID, you still potentially are. And we know that COVID can sometimes not have symptoms as well. So you might not know whether you or someone else has symptoms. So I think from a public health perspective, we would say, let's just wait if possible, because, you know, we don't want the rules and regulations in there. We don't want social distancing. They're there because of the risk to the whole community and to the country. So I would encourage everyone to follow those as much as possible. I think if you're still thinking about that, you might want to look at, you know, the Terence Higgins Trust website or other web, you know, and I think the LGBT Foundation has a page as well about it and about the risks really that you'll be facing. So I would discourage it, but I realize it's really difficult because I think we've all been missing the things we want to do. So it's a real challenge for everyone this period.
Thank you. Okay, next. I've been vaccinated for 2 months now. When will the second dose be offered?
Yeah, so as I said before, it should be offered sort of the 11th, yeah, between the 11th and 12th weeks after your first dose. And, you know, depending on where you've been vaccinated, if you were at the Brighton Centre, you already have booked your second dose. And if it's through one of the GP vaccination sites, they will text you if you have a mobile or call you to give you your second vaccine. So the clinics are put on a sort of planned at quite short notice. So don't worry if you haven't heard up until about the 10th week, you will get done.
Okay. Are you monitoring gender and sexuality in the vaccine programme? And if not,
No, we're not. I couldn't say why not. I don't know if there's a public health view on that.
I mean, I am aware that ethnic group is being monitored when you go and have your vaccination, but no, gender identity certainly and sexual orientation isn't being monitored. If it's about research, of course, GP records may have that information on for many people, but no, it's not being monitored within the programme, is it? I don't know the reason why. I think because it's a massive program, that there's a need to try and make it as efficient as possible and collect as least information, you know, the minimum amount of information, but no, that's not collected.
Yeah, and you know, and when we collect data, we then have a huge responsibility for it to be secure and confidential and stuff. So you know, which isn't without its problems because we're using a system to log the vaccine on that then has to drop the information into the GP practice, you know, so the more information we keep like that, the more of a challenge is to make sure it stays secure and confidential.
Absolutely. And actually, when I mentioned GP practice data, of course, I didn't want to imply there that data isn't confidential and secure there. That's absolutely not the point. I was just thinking where data is stored, just thinking about where data is within the system on those kind of issues. But no, absolutely, the importance of confidentiality is just paramount.
thank you. Is there going to be enough vaccine to go around?
I think the answer is yes, but there are some ups and downs in the supply. You know, if we look at AstraZeneca, I think the UK order is potentially 100 million vaccines, and there are many millions of Pfizer's and other ones also been ordered. So there will be enough to go around. The supply of vaccines sometimes is there's a lot of them, and sometimes there's less. So, but that is why the government have said they want to have every adult offered a vaccine by the end of July.
I also think the media have enjoyed the stories around the vaccine supply and the toing and froing from Europe and India and all of those things, and perhaps made more of it than helpful.
Okay. Will the vaccination interact with my PrEP or PEP medication? Similar to another couple of questions.
Yeah, I mean, just at the moment, there's no sort of scientific reason looking at the way that these drugs and the vaccine works to believe that. You know, there's ongoing monitoring. You know, people are asked to report any unusual side effects, and obviously it's being monitored very closely by the sort of bodies responsible for the authorization of drugs and vaccines, you know, across the world. So, you know, if anything was coming up of concern about that, I would have thought we'd have seen something by now.
LGBT people of colour are twice as likely as white non-LGBT people to test positive for COVID-19. Why aren't we being offered the vaccine as a priority?
So this was considered nationally by the Joint Committee for Vaccination and Immunisation, and they have decided that they have prioritised saving lives across the whole population, and they found that the fastest way of doing this was to work on age and the priority groups I mentioned earlier, like whether you're a healthcare worker, whether you're a care home resident, etc. So they did a lot of work looking into it. I know there's been a lot of discussion about it nationally, and I think it's fair to say some people don't agree. Like I recognise that point of view, but that is the decision that they made nationally, and they used science in order to come to that opinion. I think the other thing, Becky, do you want to emphasise that we're reaching out though?
Yeah, we're doing a lot of work with our local communities around understanding any hesitancies, making access to the vaccination as easy as possible for people. And it's right that people have questions because it's their health, and that's quite healthy to have questions about your health and well-being. But we are working very closely with our community leaders, and only last night some of our colleagues went to the Muslim Forum to discuss vaccinations, to help answer some of the questions that people had raised. And I know that the local NHS and the council are working very closely with the Black and Asian minority ethnic forums, staff forums as well, to get the message out through the different communities very proactively to try and make sure that everybody who is entitled to a vaccination is confident in having one.
Okay, thank you. How does the vaccine affect somebody who has been on estrogen for the last 20 years? I've looked and there's no data at all.
Well, yeah, I think that's right. I mean, these are new vaccines, and you know, absolutely correct. There isn't any data. Again, just in, you know, there doesn't seem to be any scientific reason when you look at estrogen and look at the vaccine that there should be any kind of interaction at all. And you know, obviously, as I said before, the monitoring that's going on worldwide, you know, hopefully would pick up something significant if there was a concerning sort of interaction. So yeah, there isn't the data. There's ongoing monitoring, and you know, and that will continue. and that's the way in which we pick up if there's anything concerning.
Okay, thank you. Pfizer and AstraZeneca said that they have not asked vaccine study participants to report their sexual orientation or gender identity. Do you know why this monitoring didn't take place? It leaves me as a queer person without any studies to reassure me that I'm going to be okay.
Okay. I mean, I think that sort of goes back, to the monitoring before, but I guess, a queer person, I'm one myself. I wouldn't see my body as necessarily being different to non-queer people as such. So, when it comes to this vaccine and the trials that were done on it, I'm reassured that I'm not so different from the people on the trials.
Anybody else?
I was
Okay.
captured it.
Perfect, thank you. Okay, next question. I simply can't face going to the huge vaccine centre. I can barely cope with going to the small co-op around the corner. I'm so anxious being outside. Can I go somewhere smaller and more friendly where I know other TNB people to get my vaccine, please?
Yeah, so absolutely. If you call, if you're in one of the local GP vaccination sites, then I would give them a call. I put the booking number for the Brighton race course and have a conversation with them. We can do some people at home if they really can't get outside. And then Becky talked about, the mobile vaccination unit, and certainly looking at where we could usefully sort of deploy that to help people such as the questioner.
Okay. More of a statement. I don't have a question, but I wanted to say in response to the flurry of advertising that none of my LGBT friends are speculative of the vaccine. I don't mistrust the vaccine either. I mistrust writers who work to build the false narrative of the monolithic and in brackets LGBT community. Would you like to respond to that?
Billy, I lost the last half of that. Sorry.
Shall I start again?
Yeah, sorry. You keep.
I don't have a question, but I wanted to say in response to the flurry of advertising, none of my LGBT friends are speculative of the vaccine. I don't mistrust the vaccine either. I mistrust writers who work to build the false narrative of the monolithic LGBT community.
Well, I could make a start. Again, I lost the last little bit, but I think there are a lot of conspiracy theories around, some of which are you can sort of understand, and some of which are a bit crazy, in a lot of ways. So like tracking devices and the such, like where your mobile phone does that for you perfectly. But it is difficult. There are lots of people, the research indicates that lots of people get their information from many sources. So not just, standard websites or the news or the BBC website or whatever it might be, but all sorts of different, their peers, from their friends, from obviously their social media, and internationally as well. And I know from talking to people from different parts of the EU, again, there are all sorts of different theories. So it's reassuring. The first part of the person's statement is really reassuring to hear. And I really relate to that. Who is it who's informing the narrative around vaccinations so unhelpfully? Or I was going to say.
It's great that they're, in the first half, they say, their friends don't mistrust the vaccine. So I'm really pleased to hear that. I guess we are aware from research that across different groups, and that's some Black and minority ethnic groups, some faith groups, there is a lot of, questions around the vaccine, which is why we're doing events like that to reach out into all the communities within Brighton. We're not just doing this LGBT session. We've done ones, you've mentioned the Muslim community, we've done ones for Hungarian speaking people,
Neighborhoods,
Jewish community. So what we're
people with
doing as
disabilities.
a big team is reaching out, because we know people do have questions. Often they don't trust the government, they have questions about medicine. So we're not selecting one community. We want to just reach out across Brighton and make sure that everyone gets the good information, the right information, so they can make that decision.
Yeah, and I kind of appreciate the comments about the sort of monolithic LGBT community, because we're all individuals within that. But I think what we've demonstrated that under the sort of LGBT banner, there are a specific set of questions you wouldn't necessarily get from other communities, or if you had a sort of general smattering of the population. So I think it's been useful in that respect.
Thank you. Okay, this is the last question I've got. And quite simply says, how much protection from Miss Roper will the vaccine give me?
Well, so I think from what we know for both vaccines is that it's pretty much 100% effective at meaning that you won't get severe disease resulting in hospital admission. Is that right, Alistair? Can't remember that.
I think the most severe disease, it's very, very high level of protection.
Yeah.
Milder disease, slightly less. But the other thing, I guess, is because it's vaccination, it's how many people take it around you, and we don't quite know whether it stops you passing it on as well. But these are good vaccines. These are the ones that provide, they're safe and they provide very high levels of protection. But the more of us that are protected by them, the better for the whole community.
Yeah, and I think they're probably more effective than the flu jab, aren't they? And even I hadn't appreciated this, but actually the flu jab is similar in that, because I get a lot of patients coming, I don't have the flu jab anymore because I got flu. And actually that's true, they probably did get flu, but they didn't get really bad flu and didn't end up in hospital. So yeah.
Okay, if there's anybody watching that has a question, now's the time to send it through. I've got through all of the live ones so far, and to be sent. So is there anything that our panelists would like to add to close the session?
I mean, I think I would just say, I think when I thought about having the vaccine, and I kind of was working and someone said, right, it's your turn now. And it's like, I hadn't really kind of thought it through and everything. And I think, my major motivation is, come on, let's all have the jab, so that we can get out of this, because the sort of mental health, social, economic costs have been so huge, that I think we should all try and play our part and do all that we can so that we can get back to some normal living, because on a personal level I'm not sure I can carry on much longer this way, so let's all pull together and get out of this.
My last message was just to thank everybody for having us to come along and talk, and I hope that people found it helpful, and I'm no doubt that you'll come back to us with some, if anything else comes up, Billy, won't you?
Thanks, and I absolutely agree with everything that Simon said. I guess I would add, and then let's wait until everyone's protected and follow the kind of rules and regulations until then, rather than changing our behaviours immediately, because we're all on this journey together. It's not who's first through the gate. We all have to go on that. So I would emphasise that. And as Becky said, if there's any more questions, or if it would be helpful to have something else like this in future as well, another point, would be delighted to come back.
Brilliant, thank you. Well, that just leaves me to thank our panelists, Becky, Simon and Alistair, and to thank Brighton Hove City Council, the Rainbow Fund and Scene Magazine for enabling us to do this today. So thanks everybody for tuning in and watching, and as our panelists said, if you've got any other questions, do send them in and we'll make sure that as much as possible is answered after the close. Thanks very much.
Thank you.
Thank you.
Bye, everyone.
Bye.